1. Which aspect of day-to-day life is least affected by someone who lost all of their sight in an accident? A. Self-care. B. Mobility. C. Communication. D. Work tolerance. Two, people undergo a lot of changes as they age, most of them are negative. During middle adulthood, which of the following is a change that does not happen frequently? A. Skin elasticity decline. B. Reduced metabolism rate. C. Reduced flexibility and strength. D. Decline in cognitive ability. Three, as a healthcare worker, what is the best response you can give to a patient after he discusses his concerns with you? A. To lighten the mood by making a joke. B. To nod and respond in a positive but realistic manner. C. To quickly move back and forth before responding. D. To look in different directions while speaking with him. Four, inside the hospital, a fire started and quickly spread, so patients must be evacuated. Which patients should hospital staff prioritize? A. Patients who are ambulatory. B. Patients in need of help with transportation. C. Patients in the operation room. D. Patients in the critical care unit. Five, it is Mark's responsibility to move a patient from one bed to another. In this case, which of the following statements is true? A. When there are two aides available, they can raise and move the patient's sheet. B. A slide sheet needs to be placed under the patient. C. It is easier to move a patient when their bed is slightly inclined and higher than the waist. D. Regardless of size or weight, he can lift any patient by himself if he uses the right technique. Six, Tom is interested in becoming a certified nurse assistant or CNA. What needs to be fulfilled for him to become a certified nursing assistant? A. Ensure to pass the written and practical exams. B. Attend the lecture and complete all of the workshops. C. Complete the coursework, pass the exams, and accumulate a certain amount of hours teaching CNA principles. D. Complete the coursework followed by passing both the written and practical exams. Seven, which of the following actions is deemed unethical for nurses? A. Disclosing to an investigative body the patient's current state of health without the patient's consent. B. Reporting a mistake made by a coworker who is attempting to conceal the incident. C. Granting a terminally sick patient's request to cease treatment, provided that the patient is aware of all the risks involved. D. Refusing a patient's close relative's request to keep their health status private. Eight, which of the following would be the least effective in helping you connect with a patient who is trying to communicate with you? A. Stepping closer and paying attention to his concerns. B. Remaining silent yet paying close attention to what he's saying. C. Staring blankly into his eyes while maintaining eye contact. D. If unsure that your understanding of his concern is accurate, you should ask for clarification. 9. Which of the following is the best reason for maintaining proper hygiene as a healthcare worker? A. To present yourself to patients and co-workers in a professional and presentable manner. B. To protect both you and your patients from illnesses that could spread as a result of poor hygiene. C. To boost your self-esteem and give you more confidence when handling hospital-related concerns. D. To prevent receiving verbal warnings and memos from your superior. 10. Which of the following types of medications is the most appropriate to give a 65-year-old patient who has been experiencing chronic constipation? A. Oral bulk formers. B. Oral osmotics. C. Oral stimulants. D. Enemas. 11. A mother whose daughter has iron deficiency anemia is being taught by the nurse. The nurse determines that she understood the dietary changes if she A. Selects dark green leafy vegetables and oranges. B. Selects cookies and milk. C. Selects potato chips and soda. D. Selects pork and beef meat. 12. Which of the following describes the clinical presentation of G6PD that occurs most frequently after aspirin intake? A. Thalassemia. B. Hemophilia B. C. Liver failure. D. Hemolytic anemia. 13. What kind of acid-base imbalance should a nurse be looking for in a patient who has an ileostomy? A. Metabolic acidosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. 14. When a patient experiences metabolic acidosis, the nurse expects which of the following reactions? A. 30 cpm respiratory rate. B. 20 ml urinary output. C. 42 degrees Celsius temperature. D. 110 bpm heart rate. 15. The phosphorus level of a client is 5.0 mg or dL. The client is closely observed by the nurse for A. Increased blood sugar. B. Hypoglycemia. C. Cardiac dysrhythmias. D. Signs of tetany. 16. A child with pyloric stenosis is being cared for by a nurse. The nurse would keep an eye out for symptoms of A. Constipation and signs of dehydration. B. A lot of vomiting. C. Dark-colored stool. D. watery stool. (17) Which of the following male clients, young adolescents and adults, has the highest risk of developing testicular cancer? A. A teenage swimmer on a varsity team. B. Undescended testis in a 20-year-old male. C. A basketball player who, when playing, wears supportive gear. D. A patient with a history of colon cancer in their family. (18) The post-thyroidectomy patient will be routinely evaluated by the nurse for A. Laryngospasm. B. High blood pressure. C. Hypoactive deep tendon reflex. D. Polyuria. (19) What will the nurse conclude if an 18-month-old baby seems to have a round belly, bow legs, and a slightly larger head? A. The child has a delayed developmental stage. B. The child seems to be typically normal. C. The child may have neurological issues due to his huge head. D. The child appears to be malnourished. (20) After a spinal fusion, the patient should be instructed the following as part of his discharge instructions. A. Avoid taking long walks. B. Avoid climbing the stairs. C. Avoid swimming. D. Avoid bending and twisting at the waist. (21) Before obtaining the patient's history, what actions should a nurse take? A. Build rapport. B. Request relevant details for insurance purposes. C. Give a glass of water to the patient. D. Request the patient to change into a hospital gown. (22) Before starting a physical therapy evaluation, Marco is looking over a patient's medication list. The patient is complaining of peripheral neuropathy-related nerve discomfort. In the context of neuropathy, which of the following medications are often prescribed for discomfort connected to nerves? A. Flexeril. B. Gabapentin. C. Lisinopril. D. Medrol Dosbac. (23) A week ago, during a soccer match, Alexa sprained her ankle and is now seeking evaluation at physical therapy. Before creating a treatment plan, the therapist wants to rule out an anterior talofibular ligament injury. Which examination would determine whether the anterior talofibular ligament is intact? A. Windlass mechanism test. B. Anterior drawer test. C. Eversion stress test. D. Taylor tilt test. (24) Tony seeks physical therapy complaining of upper abdominal pain in addition to his primary complaint of mid-thoracic pain. After asking more questions, the evaluating therapist finds out that Tony has occasionally had breathing difficulties, acid reflux, and difficulty swallowing. To rule out a hernia as a possible differential cause of Alex's symptoms, Tony's therapist sends her to see her primary care physician. Which hernia among the following could be the cause of Tony's side effects? A. Hiatal hernia. B. Inguinal hernia. C. Femoral hernia. D. Umbilical hernia. "25. Georgia recently suffered a stroke that left her paralyzed in both her upper and lower extremities and with a contracture in her left upper extremity. She is focusing on gait training as part of her inpatient rehabilitation program to help her move around her house and the neighborhood in a functional manner. Which of the following assistive devices is the most suitable to use for Georgia? A. Loft-strand crutch. B. Rolling walker. C. Hemi-walker. D. Single-point cane. 26. While working with a patient who has been diagnosed with carpal tunnel syndrome, Lucy would like to track significant functional improvement over time to assess the patient's development and assist in creating goals for the care plan. In this situation, which of the following outcome measures would be appropriate? A. Dash. B. CSI. C. ODI. D. FAAM. 27. Brian is concerned about falling at home because he has noticed freezing episodes related to his Parkinson's disease. He has been using the specific ways his physical therapist recommended to combat freezing episodes while walking with remarkable effectiveness. Which of the following strategies are not recommended to help people with Parkinson's disease overcome freezing episodes? A. To help initiate a movement, shift your body weight from side to side. B. Strive to step forward further to help initiate movement. C. Before trying to go any further, move the arms back and forth. D. Before attempting to walk any further, count 1, 2, 3, go. "28. The use of platelet-rich plasma or PRP therapy to treat a range of illnesses is growing. What is the best way to describe PRP therapy? A. A treatment meant to stimulate the body's tissues to heal. B. A musculoskeletal injury experimental therapy. C. A surgical technique that improves musculoskeletal performance. D. A treatment mainly to manage pain. "29. Robin is assisting a patient who will soon be discharged from physical therapy as part of a plan of care for subacromial pain syndrome. To be considered for admission to the police academy, the patient must perform both closed and open upper extremity kinetic chain exercises. Which of the following describes an upper extremity closed chain exercise? A. Bench press. B. Biceps curls. C. Pull-ups. D. Standing lateral shoulder raises. "30. Jan chooses to do the straight leg raise test to have a better understanding of the underlying symptoms since he believes that his patient's lower back pain with radicular symptoms could be discogenic. What results from this clinical test for discogenic pain are considered positive? A. The primary symptoms are reproduced at an elevation angle of less than 40 degrees. B. The primary symptoms are reproduced at an elevation angle greater than 40 degrees. C. At an elevation angle of less than 40 degrees, the primary symptoms are addressed. D. At an elevation angle of greater than 40 degrees, the primary symptoms are addressed. Aide is doing an examination on a patient who has had a catastrophic brain injury and is undergoing rehabilitation. After Aide examines the patient, cranial nerve VI is dysfunctional. In this patient scenario, which of the following presentations would you anticipate seeing? A. Trouble swallowing. B. Lateral movement of the affected eye or eyes is difficult. Lateral movement. C. Difficulty smelling. D. Difficulty with chewing and biting. PRP treatment has been administered to a patient for a musculoskeletal injury. How long is the usual delay between injection and physical therapy? A. 5 weeks. B. 2 weeks. C. 1 week. D. 5 days. Prometric practice test. Whether you're a medical professional aiming for licensing success, an IT enthusiast striving for certification, or a student pursuing academic excellence, the Prometric practice test is your key to unlocking your full potential. In today's competitive job market, standing out from the crowd has never been more crucial. The Prometric practice test offers a simulated experience that mirrors the actual exam conditions, providing invaluable insight into your readiness and arming you with the confidence needed to ace the real thing. Types of exams: healthcare or nursing, pharmacy, medical specialties. Information technology or IT. Finance and accounting. Real estate and professional licensing. Education.